setting the stage that we are here to answer questions about the COVID and flu vaccines. We got a bunch of questions. The main question, I know we only have 30 minutes. David, I was hoping maybe you can start with sort of an overview of where we're at. So what is it that the CDC is saying? Then there's the AAP. Like, what are the current recommendations?
Yeah, so hey, this is really confusing. Don't worry, I asked AI to help and make a flow sheet. And so I've got a really handy flow sheet here, super simple, right? If you start here or start here, right, you just have to follow the directions here and you can figure it out.
No
So
problem.
Oh no.
Oh no, David, we were so good and then we lost you. Oh gosh. Okay.
Well, you know what though? If anyone took a screenshot, we're good to go with that flow chart.
Wait, let me just ping him. David, we lost you. Okay. So right now, and I'll just spitball. Is that the right phrase? Just for a little bit while we wait for David. But the CDC's ACIP has come out with some recommendations, and the American Academy of Pediatrics has come out with their set of recommendations, and they are not in alignment. And this is causing a lot of confusion for people, myself included as a parent. It's like, can my kids get the vaccine? Sorry, David's writing. He doesn't know he fell off. Rejoin. And I just want to get into a little bit of background that historically, insurance companies are required to, under the ACA, insurance companies are required to cover vaccines that are recommended by the CDC's ACIP, right? And so now there's a lot of, some states are sort of pushing for, okay, well, can we adjust the policy where insurance coverage could pertain to vaccines that are recommended by medical organizations like the AAP? And so, yeah, nothing is set in stone. I think, there's a lot in progress. Some states are really pushing for policy change.
Yeah.
But yeah, so those recommendations have a lot of ties to coverage. And so if you show up to get a vaccine, you want to know, are you going to have to pay out of pocket, or is this going to be a covered vaccine? Because I know when I go with my kids, I don't even think about paying. If anything, usually I get a coupon from CVS, right, for getting my kids vaccine. Yeah. So while we wait for David to figure out the tech issue here, and let me see, can I remove him? Can I remove someone? Jeremy, are you here? Can I remove someone from a live and maybe he could rejoin? Does anyone know? Gosh, we are really a mess here. All right, invite to join. Here we go. I think I just did something. We'll see if that works. Amy, we got oh wait, David's back.
He's here.
Ooh,
okay,
there we go.
Okay, I was just
Don't touch
riffing,
anything.
Giving a little bit of background on how insurance companies typically follow CDC recommendations, but now some states are looking to split, and maybe they could align with the AAP's recommendations. But what are the different recommendations? Can you just kind of jump in?
So it's really complicated. So first, let's start at the beginning. The FDA approves and licenses vaccines. Okay, that's different than giving a recommendation. They approve and license. And then the CDC, along with input from their independent, or formerly independent, advisory committee called the ACIP, you hear that name a lot, right? They weigh in on what should be recommended. And then the CDC makes recommendations on who should receive a vaccine. Okay. At the same time, for decades, the American Academy of Pediatrics has also gone through their process for recommending vaccines. And you haven't heard about it until now because they usually line up. We call it harmonize, right? Those recommendations usually harmonize with the CDC recommendations. So what we have seen with COVID-19 this year is that the American Academy of Pediatrics last week came out with recommendations that are a little different. They're nuanced and a little different than the CDC recommendations. The current CDC recommendations that are based on that didn't go through the normal vetting process and are not based on an ACIP member vote like usual. But the current CDC recommendations say that children who are moderately or severely immunocompromised, like their immune system is not functioning normally for some reason, they should receive the vaccine. All other children, including healthy children, should use a process called shared clinical decision making to decide whether they get the vaccine. Now, the problem with that is that it's not a routine recommendation, and it's difficult often for many vaccinating providers to do the shared clinical decision making. Now, I want to stop there and just say we always help walk parents through what's best for their child, right? That is what we do, and it is ultimately their decision. The American Academy of Pediatrics is a little different. They said, hey, we recommend all kids under 2 should be vaccinated. And kids that are older than 2, if they're high risk and have high risk conditions, they should be vaccinated, but the vaccine should be available for everyone. So hopefully that breaks it down. Hopefully that was better than this.
Just a little bit better than that.
That is what broke the internet.
Yeah.
Yeah, probably.
Well, and this is sort of hot off the press, but I just received 300 messages about this. So
Yeah.
I don't know, David, that you've seen this, or Amy, that you've seen this, but I guess RFK just tweeted that he promises 4 things. 1 is to end COVID vaccine mandates. 2 is to keep vaccines available to people who want them, especially the vulnerable. 3 is to demand placebo-controlled trials from companies. And 4 is to end the emergency. But at the bottom of this, it says, in a series of FDA actions today, we accomplished all 4 goals. The emergency use authorizations for COVID vaccines, once used to justify broad mandates, are now rescinded. FDA has now issued marketing authorization for those at higher risk. Moderna, 6 months and older, Pfizer, 5 months and older, Novavax, 5 years and older, and Novavax, 12 years and older. These vaccines are available for all patients who choose them after consulting with their doctors.
Okay.
Yeah, I mean, I guess that leaves a lot of us questioning, does that mean that Pfizer's vaccine for the 6 months to 4 years is off the market? What are the actual recommendations? Because as we said, those recommendations will tie to insurance coverage. So, I mean, really, this is just hot off the press, y'all. So I haven't had time to absorb this, and I know, David, you have not either. This literally, and then it looks like there was a New York Times article that just came out literally 30 minutes ago. FDA approves COVID shots with restrictions. So it seems like there might be some limited access for certain groups. I can't comment on this yet until I can absorb this.
Yeah. Well, so I'll give you my gut reaction because I was expecting something like this, right? And this had been reported for the past week that something like this was potentially going to happen. So based on what I'm reading, and this is on the fly in the moment because I'm just reading it now as well, right? So previously there were 2 vaccines available for younger kids, that age group that the American Academy of Pediatrics says, hey, you should get a vaccine because children under 2 are still being hospitalized. They're still dying from COVID. Okay. Often they're seeing COVID for the first time. That group now only has 1 option, and that's Moderna's vaccine. Because it looks like Pfizer's vaccine, it was under a kind of a different approval pathway called the emergency use authorization. That looks like that's been removed. So if that's the case, right, and I need to read more about this, but if that's the case, that means immediately the only option available is the Moderna vaccine for those younger kids that are at higher risk from COVID-19. That could be an issue. That could be an issue for supply. There may be vaccinating providers, whether that's a clinic or a pharmacy, that were depending on or had planned on Pfizer's vaccine, okay, for those children and is not going to be able to get that anymore. So that could potentially cause disruptions.
The other thing so it's a little confusing, and there's a lot in our little chat going on. We'll have to catch up with it, but so the agency authorized the vaccines for people who are 65 and older, who are known to be more vulnerable to severe illness. It does not look, I don't see any recommendations for younger, otherwise healthy adults or for children. So by saying something like you could still get the vaccine if you want it, that feels like it's not being total. And David, I'm curious what you think, but it doesn't feel like that's being entirely honest about the situation because, yeah, I guess you could still get it, but
Right.
you might be paying out of pocket for it, which would
Right.
be cost prohibitive for a lot of
Yeah.
people.
Yeah.
Yeah.
So not necessarily.
Okay.
This is when I talked earlier about how the FDA approves and licenses vaccines. It is so a vaccine that is indicated on the FDA label for over 65 or people with high risk conditions could still be given to healthy people. If that's done, it's called off label use.
Okay.
Now, a lot of people that aren't familiar with this think off label use. That sounds illegal. That sounds like something that physicians and vaccine providers can't do. But actually, off label use of all sorts of medications is very common. One estimate that I saw is that 1 in 5 prescriptions are used off label. Okay, so this is a common thing to do. And insurance coverage is not tied to FDA labeling. Okay, so
Mhm.
this move today doesn't necessarily affect insurance coverage today.
Right. Right. Okay. Okay. So we have a lot of parents who are like, well, what does this mean? Could I still access the vaccines for my kids? Could I get the vaccine? Do you know how to I don't know how to answer that right now.
Yeah, yeah.
Yeah.
Well,
Um,
again, I mean, I will show you our
Perfect.
figure. So
Perfect.
what
Yeah.
I'm telling parents is really stay in contact with your pediatrician and their office and see what they have heard and what they know about the both eligibility, like is your kid eligible, and is your kid gonna be able to get it at that clinic? Now, I
Mhm.
understand families are calling clinics and clinics are saying we're not sure, we're confused. Because I
Right.
talk to those providers and I try to explain to them, and they're confused. There
Right.
is this is chaos as far as this is so outside of the normal process that there's a lot of uncertainty about
Right.
whether kids will
Yeah.
be able to get them and if they can, where.
So before we move to flu, which is a little different, Amy, would love to hear. We got some questions from people. Can you just tell us, like, why are we even talking about updated formulations? So, as an immunologist, why do we need to get an updated COVID vaccine every year? Why are there new formulations?
Yeah, that's a great question that, as you might imagine, I get all the time as well. So influenza is,
Tell me that Amy
can you
froze.
see me now?
Now
Can
we
you
see
see
you.
me
Yeah.
All right,
now?
we got
Okay.
you.
I just canceled the call from my husband just like that.
How dare he?
Mm.
So influenza is a virus. SARS-CoV-2 is the virus that causes COVID-19. And viruses, what they do is they change to survive. And influenza viruses change yearly. SARS-CoV-2, we know, changes quite a bit as well. And one of the things that's most important is they change what they look like on the outside. So the outer, like the spike proteins or, the proteins that surround the outer portion of the virus, they want to look different so that when they come into your body the next time, if you encounter them, I like to say out in the wild, like the grocery store, at a soccer game or school, they're going to look different and your immune system is not trained on the newest mutated, changed version. So we have to get updates every year because we want to make sure that our immune cells are being trained on, are given practice, harmless practice with the what's in the vaccine. So that is why we need to do it. It's because viruses want to survive and they change and mutate all the time so that our immune systems can't detect them as easily. So that's the main reason.
Okay, thank you. Super smart, Dr. Bernard, for that
Oh.
explanation. All right, David, let's shift, and we could always jump back and forth, but just want to make sure we're talking a bit about flu vaccines. Can you give an update on where we stand with the updated flu shot for the 2025 to 26 season?
Yeah, so this year I expect influenza vaccine to be available just like they haven't been in previous years. Okay, so I don't expect right now, any significant disruptions in
Mm-hmm.
that. Okay.
Mhm.
There was, a decision to remove certain multi-dose vials of
Yeah.
flu shots, right? And these are when, you have 10 doses in a single vial and you draw up a dose for each patient when they come in. That those have been removed and likely won't significantly influence supply. So I expect that parents who want their kids vaccinated against influenza, which I highly recommend, that they'll be able to get that this fall as usual.
That's good news. Happy about that. It seems like flu is a little bit more stream. Like we know a bit more what to expect with the flu vaccines.
Yeah.
And a cool thing about flu vaccines. So we did get a question, Amy. I'm going to ask you in a second
Okay.
about. There's a question: do they predict the mutation for updated vaccines, or already know the mutations? I think that was for COVID vaccines, but just real quick on the flu vaccine side of things,
Hmm.
I think it's cool. People don't realize that we base in the Northern Hemisphere the formulation on what's going on in the Southern Hemisphere. So
Yeah.
places like Australia, they have a different flu season than we do, right? It
Hmm.
comes earlier than ours does. And so we see what's circulating there and
Hmm.
we base our formulation on what happens there. So I just thought that was really, really
Yeah.
fun to share. Can you comment though for the COVID vaccines, Amy, how we like what is it? How do we know what to how to formulate the vaccines against the mutation du jour?
Yes, the newest variant. There are labs that are going to be continually monitoring and collecting and sequencing the data for the latest version of SARS-CoV-2 or those variants, and then seeing upticks in which variant is infecting the majority of the population in certain areas. And over time, when a new variant kind of takes over, they're starting to have the SARS-CoV-2, I think, and David, you can, or both of you correct me, but have it be given ideally in the fall at similar timing to the flu. Although I don't think we see as much of a seasonality with SARS-CoV-2. I think that they're trying to make it for convenience of the people getting the vaccines to have that kind of fall in line with getting your flu and COVID vaccines in the fall. So they're looking at the most popular, highest surviving variant at the time to produce that. But yeah, they're just looking at the sequencing of the variances over time, which variants are taking over. I'll tell you what, SARS-CoV-2 is very good at being a virus. It is amazing. It changes all the time. It's always, I call it like the witness protection program. It's always changing what it looks like so that, it walks into a new place and nobody recognizes it. So it's it looks different all the time. And that's why we have to have those updated vaccines. But I, and you can correct me, David, if you know otherwise, or Jess. I don't think it's the same set of collaborative laboratories that are looking at SARS that also look at the flu, but there are labs that are collaborating and sharing data from across the globe as different SARS variants start to uptick.
Yeah, the process for kind of figuring out, okay, what strain is going to be best next has naturally kind of fit several decades now for the flu vaccine every year.
Mm-hmm.
But it's not a perfect fit. And
Yeah.
we recognize that because flu has this very predictable pattern,
Yeah.
right? Where we start to see it come October, November. It peaks just after the holidays when everyone goes and visits each other and shares more than just their, desserts and things. And then it goes away. But COVID, we're seeing over the past kind of 2 seasons, the late summer wave, right, that we're kind of seeing right now, and then
Yeah.
also a midwinter wave.
Yeah.
So, but it naturally choosing the strain naturally fit into some of the processes we already had in place for choosing the influenza vaccine. And remember that the manufacturers of these vaccines, they need some time to manufacture.
Yeah.
So when the FDA says, hey, we recommend this strain based on all of these labs around the world that are testing all this stuff, this is what we predict, they need some time to make it. And the COVID-19 vaccine, because of the technology, they're able to make it a little faster. But the flu vaccine, depending on which one you're
Yeah.
talking about, takes a long time to
Yeah.
make it. It's made in a little bit of in a way that we've been using for a long time, and all of us hope that we can improve the speed at which we make the flu vaccine so that we can respond more quickly.
And in terms of, oh, I'm sorry, no, go on, Amy.
I just wanted to put in a plug for to emphasize what David was mentioning, that these mRNA vaccine, the technology that we have is a little bit more flexible and a little bit, I think, shorter time period to turn around.
Mhm.
So that's what's so important with the mRNA technology, and what's so devastating if it's taken away is that we can be more responsive and more rapid in how we develop these things for emerging infections. So I just wanted to put a plug in for that.
Yeah.
So, okay, a bunch of other questions. In terms of timing of flu vaccines, I think typically we recommend like September, October, right? Remember, it takes oh, David has something to say
Ah,
about that.
flu before boo. Get your flu before Halloween. Flu
Yeah.
before boo.
Oh, okay, so I'm right. So September, October,
Yeah.
flu
Yep.
before
You're
boo.
correct.
Okay,
Yep. Just get
love
it
that.
before Halloween.
Yeah, get it before Halloween. I love that. I love that. Was it last year, the year before, we kind of got an indication it was going to be an earlier flu season? So that's why.
Yeah.
Do you remember? I think was it last year that it was like August, September, but it's
Well, we
typically,
threw
yeah.
the COVID pandemic threw it off its normal
Yeah.
pattern a little bit. It
It
sure
did.
seems like we're back on its normal pattern. So get it before Halloween.
Okay, you realize we're doing a post flu before boo because I love that. I don't know how I haven't heard that, and that's like the
Yeah.
greatest thing I've ever heard. Okay, so other things. What would you say, and this is maybe to both of you, what would you say to someone who's like, well, the flu vaccine isn't very effective. Why would I bother getting it? It doesn't seem like it works all that well. Any takers?
Amy, do you want to go first?
Um, yeah, I get that. I do get that question a lot. I would say more than that, I get something that people will say, well, I get the flu from the flu vaccine. No, you absolutely cannot get the flu from the flu
Right.
vaccine. It's like most of it, the formulation are chopped up little bits of it. So it's not the whole thing. But it's the same thing with where I would talk about COVID vaccines, where I said COVID vaccines act like seat belts in the sense that they
Mhm.
prevent serious harm and death. You may still potentially get the infection, but like a seatbelt prevents serious harm and death. I would say the same thing about the influenza vaccine, particularly if it matches the strain that eventually comes north based on what we detected in the south. So David, what would you add to that?
Well, I mean, I think it's okay to explain to a family and say, hey, look, the flu vaccine is not quite as effective at preventing illness as some of our other vaccines, like the measles vaccine, which is incredible, right? So, okay, it's not quite as good, and for some of the reasons we've already talked about.
Mm-hmm.
At the same time, I like the seatbelt analogy, right? Like, actually, wearing your seatbelt does not mean that you won't get seriously harmed or die in an accident.
Mhm.
And yeah, I still put it on every time I get in a car.
Right. Love it. We got another question here. So if you get your flu shot now, does it last through the season into next March, April? David, you could correct me if I'm mistaken. My understanding is that's why we set the right, it's sort of a sweet spot, right? To get it before boo or flu before boo or whatever, right?
Yeah.
Because you want to get it sort of before respiratory illness season really gets, really spikes, and also, not too soon because you do want it to carry through
Yeah.
that season. And we see it typically, what is it, like 5 to 6 months of pretty solid protection?
Mm-hmm.
Yeah. Yeah. So the it is there's a sweet spot there, right? And so if you got a flu vaccine in May or June, the following March or April, it might not be quite as effective, right?
Mm-hmm.
And without getting into some of the nuance of the immune response and how durable that is, I think it's important though to also recognize that if you put it off, you're gonna forget about it. Right. I'm
Right.
a parent too, right? And like a parent with school age kids, things just go in my brain and then just gone, right? And I see so many families in December, January, February that come in and maybe they got one of their two or three kids vaccinated, but the other ones were busy with sports, so they forgot
Mm.
and they're miserable. They get the flu, and the one that got vaccinated yeah, they get a little bit sick maybe at the worst, or don't even get it. But the ones that didn't are miserable, and the
Right.
family's like, we just forgot. So I always want to be careful with saying like, oh, try to time it so you can get it as late as possible. I don't like that messaging just because, hey, we all forget. So if it's September or October, right, which we're about to enter, just go get your flu shot and you'll be good.
So we got a bunch of questions that came in. I want to switch back to COVID for a second. David, I'm going to read you two questions. Can you pick one that you might want to answer? One is, my pediatrician says that low risk kids do not need a COVID vaccine. Should I ignore her and get it? Obviously, we cannot give any medical advice here. You have to talk to your own
Yeah.
healthcare provider. And then the second question, and you get to pick which one you answer, is, couldn't my doctor just have us sign something saying we won't sue them if we want to get the vaccine and it isn't recommended?
Okay, well, I'll answer both because the second one, I'm not sure it works that way, and I'm definitely not a lawyer. Okay, I am a doctor. However, I'm not your child's doctor, so you're right. I'm not giving medical advice specific to you. What I would say is that in the new recommendations from the American Academy of Pediatrics, when they did a good review of the evidence, their recommendations are slightly different than prior years. It does say that high risk kids should receive it, but the healthy kids, there's no longer a recommendation that they all get it.
Mm-hmm.
Okay, it should be available if a parent desires that protection and wants that and talks to their pediatrician about it. But there's no longer that recommendation, and so I am not going to push that parent to say you absolutely need it in your healthy child, because that's not the recommendation based on the evidence that has evolved as we've evolved along with the virus.
Mm-hmm. What would you say to someone who says, well, you told us all to get the COVID vaccine because it was supposed to stop us from getting COVID, but it
Mm,
doesn't stop us from getting COVID. And, even if you get the COVID shot, you could still get the illness. So what do
yeah.
you, oh, well, Amy, were you going to say
I was
something?
like, seatbelt.
Oh, seatbelt, yeah. Because that is something we hear a lot, a lot of frustration with some of the
Yeah.
messaging
Sure.
early on. Uh, any thoughts, any response to those folks?
Well, I also am frustrated sometimes with the early messaging that
Hmm.
did seem to imply you get your vaccine, there's no way you'll get the illness, there's no way you'll
Yeah.
spread it to others, and that immunity that you get from the vaccine will last forever. Right? Whether that was the intention or not, people heard that. And
Yeah.
that's a problem because that really is not an achievable goal for any of the vaccines that we're producing, right? We really first with vaccines, we want to prevent serious harm, right? We want to prevent serious harm and death first.
Right.
It is great when vaccines also prevent any illness or any transmission, right? So again, seatbelt analogy, like Amy was just doing, right? And so you've got to reframe your thinking around that. That yep, you can still get it, and at the same time, you still put your seatbelt on every time you get in the car, even though it's not perfect.
Well, this is amazing. What an incredible resource to be able to talk to you two. Everyone should go follow Dr. Amy Bernard, Fun Size Immune Ninja, Dr. David Higgins, Dr. Higgins MD. And I hope we could do more of these live events, and we will. Right, it was never about sterilizing immunity. Sorry, last comment.
Yeah.
Actually, Amy and I, we recorded a clip that we'll be putting on YouTube and we'll share here where she discusses just that. And we also talk about how
Yeah.
we don't love the phrase sterilizing immunity because
No.
some people didn't understand what that meant and thought that we were saying,
Yeah.
something about causing sterilization. So, okay, I know you both have to drop. We're getting some other questions. Maybe we could do some follow up on Substack or do another follow up live or something at some point. But thank you both so much. This
Thank
was
you.
great.
Sure, of course.
Yeah.
All right,
Thanks.
get your
All right.
shots. Bye.
Bye.